Arthritis is often associated with aging and wear and tear. However, it also affects the youngest among us. 3 million children worldwide suffer from juvenile idiopathic arthritis, also known as JIA. Joining us is Dr. Natasha Ruth, Professor of Pediatrics, Division Chief, and Program Director of Pediatric Rheumatology for MUSC. Dr. Ruth, thank you so much for being here.
Thank you.
When we're talking about JIA, how does it differ from adults that have arthritis?
Yeah, so it is very different, and that's why we actually call it juvenile. And idiopathic just simply means we don't know what causes it. It's likely a complex interaction between genetics and environment. But it's very different than adult arthritis unless you are a subtype of JIA where you have a positive rheumatoid factor or a positive antibody called a CCP. And that portends a little bit more of an aggressive form of disease. But JIA falls into really several different subtypes, and many of the subtypes are completely different than adult rheumatoid arthritis. We have one subtype called oligoarticular JIA, which really affects 2 to 5-year-old little girls mostly, but can occur in boys. And usually only 1 or 2 joints, really less than 5 joints, are involved at the time of diagnosis. The big thing we worry about in that population of kids is that they can also get inflammation in their eyes, and that's called anterior uveitis, and that's something very different than adults who they don't get the anterior uveitis. There's also another category that's called systemic JIA, and in that category these kids can get daily fevers, usually that occur in the afternoon or early evening, and along with these fevers they get a rash. And these kids can get even internal organ involvement and organ inflammation, and it can be severe but very treatable.
Yeah, and now in addition to those symptoms that you mentioned, typically when we're talking about arthritis, it's like this aching in the joints. Is that very common in kids as well, an early sign or symptom?
It is. So, many parents won't notice them complaining of pain per se. They'll notice stiffness in the morning. So when they're getting out of bed, they look a little bit more like an older person. They might even notice just a subtle limp, and that would be the first signs.
And I'm sure diagnosing is challenging because they're kids. How is the diagnosis approach?
Yeah, so diagnosis is by medical history and physical exam. There is no specific blood test that you can use to diagnose juvenile arthritis, and so really it stresses the importance of having pediatric rheumatology providers. People like myself are trained to examine kids and pick up on even subtle arthritis, and that's really how it's diagnosed. You have to have swelling in at least one joint for longer than 6 weeks to carry that diagnosis, and you have to be 15 years of age or younger.
With treatment, I know over the past 30 years it has grown so much, and there's so many options available now. How does the treatments differ when you're treating an adult with arthritis and then this juvenile arthritis?
Yeah, so some of our treatments are very similar, but especially in the kids that maybe just have 1 or 2 joints involved and are young age, we may be able to sedate them through our pediatric anesthesia department. We get their help, and we can actually inject that joint with some corticosteroids. But many of those kids will go on to develop even a few more joints, and then we will need to use some of the medications that are actually used in adults. So things like disease-modifying agents like methotrexate, and even some of our biologics, things that you probably heard of from TV like Humira and etanercept, tocilizumab, all of these.
Once a child is diagnosed and treated, are they able to live a normal life?
Absolutely. I always tell this story. I have a mentor that, practiced pediatric rheumatology really 40, 50 years ago. And we used to have JIA camps, and the camps would allow a sibling to come with, their sibling to this camp. And you could always tell which patients had arthritis and which kids did not. And now if you see these camps, you cannot tell the siblings from the patient. These medicines just do such a good job, and it's really rewarding to be in the field where you have this armamentarium of medications.
Yeah. And I'm sure research is always happening. Is there anything new right now?
Yeah, so one of the newest medications that's approved for kids is something called a JAK inhibitor, which is also one of these biologics. But what I would say is research is always developing. We actually have a research organization. It's our national research organization called the Childhood Arthritis Rheumatology Research Alliance. And this is where we have a national registry where a lot of these kids are enrolled, and we're able to follow them over time so that we can look for side effects from medications. We can look for new things that come up with these patients, and it's really a collaborative effort with pediatric rheumatologists across the nation.
Yeah. Well, for more information here in the Low Country, musckids.org is where you can go. Dr. Ruth, I want to thank you so much for joining us.
Absolutely. Thanks for having me.
We're back after this.